Welcome, everyone. My name is Prashant Yadav. I'm a senior fellow at the Center for Global Development. Welcome to all of you to the Center for Global Development virtually for this very interesting event on global health forecasting and the role of data science and new technologies. We all know that forecasting, both at the global, the national, and at the health facility level, is an extremely important activity to ensure high availability of medicines and essential health products. And not only availability, it also helps manufacturers get proactive information about what is needed. They can do planning better. So it improves access in many dimensions of access. CGD in 2006 had brought together a working group to focus on global health forecasting, which looked at many dimensions of the problem. Some of those dimensions, especially at the global and at the national level, have improved remarkably since that time. But we all know that in order for forecasting to be better at any level, it all starts at the health clinic, the health facility, and how they decide how much of each product, each medicine or health product to order. A lot has happened in technology, data science, new tools in this area in the last couple of decades, but in the last 5 years in particular. And we want to emulate the clever ways that many private sector and commercial firms have started using anticipatory logistics, data, new tools for forecasting in the world of global health and in health facilities in low and middle income countries. At CGD, we are hungry for evidence. And oftentimes, how we select which procedure, which algorithm, which group to use for doing the right kinds of forecasts is something that we determine subjectively. We think, oh, this is our best choice, let's go with this. So what we are also extremely excited about is that USA has taken an approach of creating a forecasting competition, which means using who can forecast the best as a means of determining how should we focus our efforts on forecasting what kind of groups to bring. And that enables us to think about this in a much more objective and evidence-based manner. So we are extremely excited about the fact that we will launch we will announce the winners of a prize competition. But let's get started. We have an interesting lineup of speakers. And thank you for all of you for joining. I'll start by asking Dr. Anouar Jean from the Ministry of Health of Côte d'Ivoire. He's the Deputy Director General and focuses on health system strengthening there, to give us some remarks about how does Côte d'Ivoire think about forecasting in general, but in particular the use of data science new tools. His comments will be in French. There will be simultaneous interpretation, so choose that on your on whatever form you're using to view this. So with that, let me hand over to Dr. Anouar Jean.
Okay, merci beaucoup.
Yes, good afternoon. Thank you very much.
Okay. Et je suis Dr. Anouar Jean, comme l'avait dit. Je représente
So
le
I am
directeur
Dr. Anouar Jean, and
qui est en mission.
we have a mission.
Que je vais dire l'allocution qu'il devait prononcer au nom du ministre de la Santé.
To talk on the behalf of the Ministry of Health.
Dr. Alma Golden,
Dr. Alma Golden,
adjoint du bureau
and
Santé
the Center
de
of the USAID,
Madame Nancy
Mrs.
Lowenthal,
Nancy
représentante de l'USAID en
Lowenthal,
Côte
who's a
d'Ivoire.
representative of USAID in Ivory Coast.
Mesdames et messieurs,
ladies and gentlemen of the Center for Global Development, people who would have the prize for the best forecasting or the intelligent forecast of the family planning. Ladies and gentlemen, before anything, I would like to translate my sincere salutation and from the Minister of Health and Public Hygiene of the Ivory Coast, from the Dr. Eugene Akawelen, who was very pleased with this initiative, at which he agreed to immediately as soon as he was informed of it.
La planification familiale
family
contribue
planning
à la
contributes
réduction de la
to
pauvreté,
the reduction
à
of
la
poverty
promotion
and
de la
the promoting
croissance
of
économique.
economic growth.
Elle améliore le
This
bien-être
family
des
planning
femmes
is better
et
for
augmente la
women and
production
increase
et
the
l'autonomie des femmes,
productivity as well as the autonomy of
concourant
women,
à mettre
and
notre pays
that put our
sur le chemin
country
de
to
l'auto-résilience.
auto-resilience.
Pour atteindre
In order
ce noble
to
objectif,
obtain this
notre pays n'a pas
objective,
hésité
our
à
country
adhérer
did not
à de
hesitate
nombreuses
to
initiatives
agree to
dans le
numerous
partenariat de
initiatives
Ouagadougou
with the partenariat
pour la
of
planification
Ouagadougou
familiale
for
depuis
the family
2011,
planning since
pour lequel je suis
2011,
heureux
for which I'm
de
very
partager
happy
quelques
to
résultats
share
avec
some
vous.
of the results with you.
En effet,
Yes,
notre pays a
our
fait de grands
country
progrès
have
pour
made a
atteindre
lot
et
of
dépasser ses
progress in
objectifs
order to
annuels
go
dans le
beyond
cadre
its
de
annual
ce
objective
partenariat.
with this partnership.
Au cours de l'année 2019,
During
au
2019,
total,
the total
417 000 femmes ont utilisé
417,000
une méthode
women
contraception
used a
moderne,
modern contraceptive method,
dépassant l'objectif de
which went
350
beyond
000
the
femmes.
353 women that we
Grâce
had.
à cette performance,
And because of this
4
performance,
666 000 grossesses non
466
désirées et
non-desired
1900 décès
pregnancy,
maternels ont
and we
été
also
évités.
avoided 1,900 deaths
Malgré
due
ces
to
bonnes
pregnancy.
performances,
Despite those
devons
good
faire
performance, we
à
need
des
to
défis majeurs
we have
tels que le
conflict and
financement insuffisant
challenges as
pour
far
un
as the
plan de
funding, which is not
communication de
enough
masse
for a
en
mass
faveur de la
communication
planification
plan
familiale,
in order to continue with
mais
the
surtout
family planning,
les
but
difficultés liées
also
à
the
l'estimation adéquate des
difficulty that are
besoins
linked to
en
the
produits
adequate
de
estimation
planification
of the needs
familiale
for
au
the
niveau
family planning
des établissements de
and
santé.
for the
Jusqu'à
health
ce jour,
facilities.
l'estimation
Up
se fait
to today,
sur
the
la base
estimation
des
is based
consommations
on
antérieures
the previous
et
consummation
comporte par
and
conséquent
has,
des
of
biais.
course, some flawed data.
L'opportunité pour notre pays
The opportunity for our
d'introduire
country
une nouvelle
to
technologie
introduce a new technology
en vue de
in order
pallier
to
à
fill
ces insuffisances
those
est la
insufficiencies.
bienvenue
It's
à
welcome
travers les
with
propositions
innovative
d'outils novateurs
tools
par les
that are
experts.
put together by experts.
C'est donc avec
It
beaucoup
is with a lot of
d'enthousiasme et
enthusiasm
d'impatience que
and
nous
eagerness
attendons la
that we are
phase de mise en
waiting
œuvre sur le
the
terrain
phase to put in
de
place
cette
on the
approche
field of
novatrice
this innovating
qui pourra,
approach, which
bien
will
entendu,
be
être
able
étendue à l'estimation
and
des
large
autres
to
médicaments
the
essentiels.
estimation of other medical
comme
supply
nous
that
le
are
savons,
essential, because as we know,
Il n'y a pas de médicaments.
there is
S'il
no
n'y a pas de médicaments,
medicine.
il
If
n'y a
there
pas
is
de
no
programme de santé.
medicine, there is no health program.
La liberté de choisir
The freedom to choose
le nombre de ses
the
enfants
number of children we
et le
have
moment de leur naissance constitue
and the
un
time
droit
of
humain
birth
fondamental.
constitute a fundamental human right.
Ensemble,
Together,
nous permettrons
we will
aux
allow
personnes vivant sur le sol
to
ivoirien
people who live on the
de
Ivory Coast,
jouir de ce
live in
droit
Ivory
à
Coast,
travers la
to enjoy
disponibilité
this
continue
right
des
through
contraceptifs
the
et autres
availability
intrants
of contraception and other tools
de contraception et autres intrants
for family
familiales
planning.
à temps réel par une estimation intelligente des besoins.
To have an estimation that is
D'avance,
smart,
je félicite les
I
lauréats
would like
de ce
to
prix et
really
leur assure de la
congratulate the
disponibilité
people
du ministère de la
who
Santé et de
won
l'Hygiène publique
this prize, and on
à
behalf of
faciliter la phase
our
de
department
facilitation
to
de l'outil ainsi que
ease
son déploiement
the use
dans le
of
système
the
de
tool
santé en
and the
Côte d'Ivoire.
deployment within the health system
Tout
in
en
the Ivory
espérant,
Coast.
au nom du ministre de la Santé et
And
de
we
l'Hygiène
would
publique,
like, in the name of
la
the
joie de la Côte
Minister of
d'Ivoire
Health and Public
d'abriter cette
Hygiene, the
importante
joy of
cérémonie.
the Ivory Coast to have
Je
this
vous
important
remercie
ceremony.
pour votre
I would like
aimable
to thank
attention.
you to have
Vive
listened
la
to me,
coopération
and vive the
ivoiro-américaine.
cooperation, American and
Merci.
Ivory Coast. Thank you. The interpreter is sorry, but the gentleman cut off in the middle of his presentation.
Thank you, Dr. Anouar Jean, for your comments. One thing I would like to add, which I didn't include in my introduction, was that while forecasting and use of new data science is important for all health products, nowhere does it become more important than in sexual reproductive health and contraceptives, where having a full choice of products present at the clinic is extremely important for achieving program outcomes. And having a choice requires putting more effort in understanding what is the demand for each particular method at the clinic. So that gives you some context of Dr. Anouar Jean's remarks. With that, let me go to Nancy Loventhal. Nancy is the country director for USAID in Cote d'Ivoire. Nancy, welcome. And we'd love to hear from you how USAID thought about this partnership and how you think about the forecasting competition and the role of forecasting more generally.
Well, thank you very much. I'm going to actually do my remarks in French, but then I can do a very short summary in English, but thank you. So, akwabar and bonsoir à vous tous. Dr. Alma Golden, administratrice adjointe du Bureau de Santé Globale de l'USAID Washington.
And we
Professor
are at the
Anouar,
office of
Jean,
USAID,
directeur général adjoint
Dr.
de
Anouar
santé. Mesdames et messieurs,
who is with
les
the
collègues
Ministry of
du
Health,
Centre de
my
Global Development,
co-worker and
chers
my peers,
postulantes au concours, mesdames et messieurs.
dear
Je voudrais
laureates,
remercier
I would like
infiniment
to
pour
thank you
avoir
very
accepté de
much
prendre
to
part
have
à
accepted
cette cérémonie. Le bureau de
to
l'USAID
be
en
part of
Côte
this
d'Ivoire est
ceremony.
très
The Ivory
heureuse
Coast office
d'avoir
of
été choisie pour
USAID is very
adhérer
happy to
ce
have
concours.
choose
Je suis
this country for
reconnaissante à nos
the
collègues du
contest.
bureau de
I am very
Washington pour
grateful
l'appui
to our
technique.
colleagues in
Je
Washington,
félicite
and I
d'avance
would
les
like to
lauréats
congratulate
de ce
in
concours.
advance the
De
laureates
même, je
of this
salue la participation des autres
contest. And
compétiteurs.
we
Ils
have
n'ont pas
seen the other
démérité. Je ne
person
doute
who were
pas que
part of this
l'expérience de
contest, and to
participation à ce
see
concours
how
le
they
sera utile
participated,
dans le
and
futur.
really this is
L'initiative
going to
de
be helpful
développer
in the
un
future.
modèle
The
prédictif
initiative
pour
to
l'estimation
develop
des besoins en contraceptifs
for the needs in contraception.
est une excellente opportunité
It's
pour
a really good
notre
opportunity
programme de
for
santé en
our
Côte d'Ivoire.
program
Nous sommes
to be
fiers
in the Ivory
d'accompagner la
Coast.
Côte
We are
d'Ivoire
very proud
dans
to
son
accompany
statut
the
du
Ivory
pionnier
Coast
pour
with
une
this
telle
status
initiative.
for this
L'expérience
particular initiative.
inspirera
The
certainement
experience will
d'autres pays dans
inspire
notre
other
région,
countries for
de
sure in that
sorte
region.
que
Then
l'utile puisse adapter à d'autres contextes.
the program
Cette
can be
importante
adapted
innovation
to other
arrive au moment
contexts,
où le programme de
and
santé
we can
de
see that this
l'USAID en
program
Côte d'Ivoire
is put
envisage
together when
accroître
USAID has
son soutien
increased
au
their
ministère de la
program
Santé
and their support to the Minister of
et
Health,
de l'hygiène publique dans le renforcement
and
du programme de
with
planification.
the reinforcement of the
Comme
planning
nous le disons souvent,
reinforcement. And as we say
pas
very
des
often,
produits, pas des
the-
programmes de santé.
no
Cette
product,
innovation
no health
technologique
program, and this
va aider à
technological
mieux estimer
innovation
les
is going
besoins,
to help
mieux
to
connaître la demande
forecast
au
the
niveau des
new
formations
need that we
sanitaires
will
et de
need,
contribuer
and to
à ce
contribute
effet à réduire les
to
ruptures des stocks de
reduce
contraceptifs.
the
Je
stock
tiens
out
à
of
remercier le Dr.
contraceptive. I
Anouar
would
à
like
travers
to
lui,
thank
le ministre de Santé
Dr.
et de l'Hygiène
Luan
publique
through
pour son
the
leadership,
Health
son
Ministry
engagement
for his
et pour le
leadership,
succès de cette
his
initiative.
commitment to this
Nous vous
initiative.
retirons notre soutien
He
dans vos
always will
efforts
have our
d'amélioration de la
support
santé de
in order to
population
improve
vive
the health
en
of
Côte
the
d'Ivoire. Je
population
vous
who live
remercie.
in the Ivory
So,
Coast. Thank you very
in
much.
short, we really appreciate that everybody who has applied themselves to being part of this initiative, and USAID Washington Center for Global Development, to all of those who you have applied and competed to be part of this. We're all winners in this, and this type of technological development now and in the future will make a huge difference. Specifically in Côte d'Ivoire, Côte d'Ivoire is being a pioneer in this initiative by undertaking this first. And not only will it benefit Côte d'Ivoire, but it can benefit other countries as well. We're very proud to be a partner to the government of Côte d'Ivoire, in particular to the Ministry of Health. And as we know in the field of health, that without products, you don't have a program. And this is our reproductive health programs in Cote d'Ivoire will definitely benefit from this, and all men, women deserve choices in their reproductive health. So we're thrilled to be part of this, so thank you very much.
Thanks, Nancy. And I think I want to emphasize one point before handing over to Dr. Alma Golden, which is it is important to recognize that doing forecasting for any health products, in particular for contraceptives and reproductive health products, using new data tools, using new technological advancements, is something where we need more vanguard countries who are willing to say, yes, this is a new way of trying this is a new way of looking at forecasting, and that'll help not only a specific country, but will create a stronger global capability in terms of the knowledge and the experience and technologies we need. So thank you once again to Cote d'Ivoire for doing this. With that, let me invite Dr. Alma Golden. She's the Assistant Administrator for the Bureau of Global Health at USAID. Thank you, Dr. Golden. We'd love to hear from you. USAID's work in forecasting, planning, and supply chain more broadly, but also how you think about getting innovation through a competition like this, which is more evidence-based, and other comments you may have. So welcome, Dr. Golden.
Thank you, Prashant, for that kind introduction and also your amazing hosting of this event. We are very grateful. Thank you, Nancy, for hosting this initiative in Cote d'Ivoire. And thank you, Dr. Arnaud-John, for a wonderful description of how this competition can support Cote d'Ivoire in achieving its voluntary family planning and health goals. We very much appreciate the wonderful partnership that we've had with your government. I'm happy to be here today and to announce the winners of USAID's Intelligent Forecasting Competition. But before I announce the prize winners, let me again thank our gracious host, the Center for Global Development. And now let me share some details on the competition. As many of you joining us today may already know, access to appropriate health supplies is often critical to achieving our health goals, just as Nancy just indicated. If the right medicines and health products are not available at the health clinics, then they are not there to be dispensed to patients or to be used by health workers. And then we can't address the needs of the patients, whatever those needs may be. Unfortunately, we also know that many of the countries that USAID supports have stockouts of essential health products, and that's a continuing and critical issue. So USAID works with the local healthcare authorities and partners through the voluntary family planning and reproductive health programs in nearly 40 countries around the world. And part of this includes ensuring that contraceptives are available and accessible to the people who need them, and so that they may choose the method that is correct for them. The reason for stockouts of contraceptives are many. One major reason is our ability to forecast or predict how much product will be of each item will be needed in the future in each health clinic. In most countries, health clinics continue to do their forecasting the same way it's been done for decades. They decide how much product to order by looking back at how much was used in recent months. On the other hand, we're seeing, particularly in the private sector, significant strides on advanced forecasting models to predict future demand. And you will hear a little bit more about that later in the program. So what led us to this competition was this question. Can advanced modeling help us improve our ability to predict the volume of contraceptives that will be needed in health clinics in the future? The best way to answer that question was through a prize competition, where anyone interested in the problem could compete with their best models. The answer we found to our question, in short, is yes. We can get better models. Machine learning-based model approaches enabled our competitors to improve upon existing approaches and to develop more accurate predictions of future contraceptive use. If we look at the best models from our winners, the median score for the model's predictions were more than 20% better. Cote d'Ivoire has demonstrated impressive innovation and openness in soliciting potential solutions outside the box, even before this. And we fully expect that the approaches utilized and the lessons learned will not only benefit Cote d'Ivoire's family planning program, but also can be generalized to improve forecasting of other health products and for other countries. We hope that this is just the start of a broader movement to improve how we forecast for health commodities and country systems. Now, let's move on to what we've been waiting for and announce our prize winners. Our first prize winner is Inventec, a Taiwan-based original design manufacturer of computers, telephones, and other technology. Inventec's Artificial Intelligence Center is tasked with advancing the company's smart manufacturing capabilities and pioneering future AI technologies and products in areas such as smart health, smart computing, and hardware. Accepting the prize on behalf of Inventec is Dr. Kristen Chen, who is the Chief AI Officer for Inventec Corporation and part of her team. The second prize winner is Dr. Rashid Rita, and Mr. Rita is an analytics professional from Indonesia with more than 4 years of experience and strong expertise in R programming. He is skilled in data visualization, statistics, customer analytics, and machine learning, and he previously won a large national data science competition in Indonesia. In his day job, Mr. Raid works as a business intelligence analyst at a tech company in Indonesia. Congratulations to you both. It's wonderful to note that our two prize winners are from different realms than our usual partners. And this really speaks to the power of using open innovation to seek cutting edge modeling. So in a few minutes, you'll hear from both of our winners. And I'd like to add that these prize announcements are not the end of the competition. USAID will also award a grant next year to an organization to work with the stakeholders in Cote d'Ivoire to customize and improve one of the submitted models and to pilot it in the field. The grant will allow us to understand how much further we can push performance with greater local knowledge, and most importantly, how to support health workers to use these types of approaches on the ground to support the clients and patients that they serve. Now I'll turn it back over to Prashant to invite the winners to speak and to learn more about the discussion and to lead more discussion on this topic. Thank you so much. Over to you.
Thank you, Dr. Alma Golden. First of all, thanks for USAID and your leadership in trying to bring new data science in this area. I think I'm excited about the winners because when this competition was being talked about, I think one of the things a lot of us assume is our prior assumptions lead us to who are the people who do demand forecasting in the commercial sector? Who are the people who do demand forecasting in the medical sector? They must be the ones who have the state of the art. They must be the ones who can do the best forecasts. But what the prize announcement shows us is our priors need to be adjusted. Our priors need to be driven by evidence. And so that excites me a lot more in terms of who our winners are and where they come from. But before delaying further, let me invite Dr. Trista Chen, who is the head of AI, chief of AI at Inventec, to share very briefly how you thought about joining this award, anything about your approach, and yeah, other comments you want to make. So brief remarks from Dr. Trista Chen.
Thank you, Prashant. Thank you, Dr. Goldman and Nancy from USA. And Dr. Anuwanwan, John from Cote d'Ivoire, Ministry of Health, and all of you participating in this webcast. Thank you all so very much. I'm Trista, and these are my team members, David and Jonathan. We're all very grateful to be here to share this winning moment with you. To add some context to Inventec AI Center, Inventec is a multinational company that makes about 100 million devices every year, from laptops to cloud servers to wearables. Chances are the laptop you're using at the very moment are made by us. Inventec AI Center is a recently established research center with core competency in algorithms and software, with the two complementary capabilities, hardware from Inventec and software from AI Center. We aim to deepen AI into our manufacturing practice, the so-called Industry 4.0, as well as to open new AI opportunities in robotics and smart health and medical AI. In particular, smart health is an ever more important topic in this COVID era. hopefully soon to be post-COVID era due to the recent pharmaceutical discovery. Our focus is in preventive healthcare and telemedicine in areas as cardiovascular or heart health, skincare, just to name a few. Inventec has always been very active in taking the responsibility of a global citizen, and smart health is the focus area of AI Center. We're very delighted to come across this competition to forecast contraceptive usage. The competition provides great potential to extend our impact to global health. Being a multinational corporation with manufacturing sites and partners around the world, such as Taiwan, China, Mexico, Czech, we are no stranger to supply chain management. Similar to our supply chain management problem, accurate forecasting of contraceptive consumption save lives and money, reduce waste by providing just-in-time service to the health service delivery sites. Equipped with our team's experience in developing and deploying AI-based solutions, in this case, forecasting and smart health, we then went on to tackle these challenges of the competition. The success of our winning competition relies on three factors. One, a thorough understanding of data. Second, a single global model. Last but not least, a clear evaluation strategy. With thorough understanding of the data, we provide better features or input to the prediction model. It's like cooking, right? Thanks to USF for providing good raw ingredients to start with. We, the chef, needs to properly prepare the ingredients, for example, washing and chopping the vegetables before he or she can make a delicious cuisine, right? Now we need to cook the dish for thousands of sites and products in Cote d'Ivoire. Sounds challenging. We then use a single global model as opposed to many, more than 1,000 to be exact, individual models. That is, we have a single model of all models. Such single model allows us to use an advanced AI model, and such model is highly scalable to a large number of heterogeneous sites. Finally, an easy to use and solid evaluation pipeline allows us to tune our model repetitively, optimizing for the highest accuracy, which is the goal of this competition. To summarize, with good input, smart global model that is very scalable, we can forecast contraceptive usage accurately across all different sites. We can't wait to see what such a beautiful model can do when it's employed to improve the health of people of Cote d'Ivoire and perhaps some more other countries. Thank you.
Thank you, Trista Chen, and also the team at Inventec. Congratulations for winning this. It is exciting that your work is helping in many ways, and we look forward to seeing more collaborations coming with you. With that, let me move on to the second winner, who is Rashid Rida. Rashid, welcome to the Center for Global Development. Congratulations on winning this prize. Again, share brief remarks with us. What drew you to this competition? Dr. Golden described your day job and other things that you do. So it has been very intriguing for many of us to learn from you how you did it, what drove you to participate in this competition, and other things you might want to share. So brief remarks from Rashid Rida.
Okay, thank you very much for the opportunity. I am very glad that I am here and grateful that I can get the second position in competition. I would like to say thank you very much to USAID for hosting this awesome competition. A little about me. My name is Rashid. I am from Indonesia. Currently, I am working as a business intelligence analyst at one of the largest tech companies in Indonesia. In day-to-day basis, I do exploratory data analysis most of the time, and then also some machine learnings, and then also do A/B testing for evaluation. I am interested in forecasting, and I have faced forecasting problems in various industries, business, finance, retail, and even weather forecasting. I participated this competition to learn and improve my skills in forecasting and machine learning. I am also very enthusiastic when I knew that my forecasting can make impacts to the people. Even though that I am not familiar with health industry, I think that in general, forecasting case is same. The goal is to predict value in the future using the value in the past. The difference might lies from the pattern and seasonality of the data. In business, usually there is a strong seasonality in weekly basis. In weather forecasting, for example, there might be no weekly seasonality, but there is a strong yearly seasonality. Domain expert and domain knowledge might be very helpful to improve the prediction accuracy, especially if the model cannot capture the pattern from the data. As the input of the model, my solution is simple and straightforward. I use historical data, type of products, and then also sites and location of the sites. I tried implementing a statistical method first as the baseline benchmark and kept improving using machine learning models. And the improvement is about 12 to 20% compared to statistical methods. Things that might be successful is that rather than building an individual model to predict the next 3 months, what I do is I use 3 separate models to predict next 1 month, next 2 months, and then also next 3 months. It improved the prediction accuracy significantly based on model validation. If I have more time to develop the model, I would like to use external data because the demand, like the yearly populations in the area, because the demand might be related with the number of population in that area. I believe that there are still many areas of improvement to increase the prediction accuracy of the model. All in all, I am very glad to get a second position in this competition. And once again, I would like to say thank you very much for USAID to host this competition. I hope that my models can create impacts to the people. Thank you.
Thank you, Rashid, and congratulations again. I think the thing that continues to get us excited is how the winners and the competition, we'll ask Glenn in a few seconds and when we get to the panel discussion, but it drew participants from essentially the who's who in the supply chain industry, in the forecasting and data science business. So it is remarkable that you have been able to create models, both you and the team at Inventec, which has succeeded and achieved higher accuracy or lower errors than any of the other groups. So that's exciting. Thank you again to the winners. We are now going to transition to a panel discussion about what does this mean for how we think about global health forecasting more broadly. Is this a way to think about sourcing new ways of bringing new technology into global health supply chains? Where else do we go with this? So I have we have 3 panelists, people who bring different perspectives to this problem. Let me introduce the panel and then I'll go to each of them separately. So we have Alessandro De Luca, who's the Chief Information Officer of Merck Healthcare, or part of the Merck Group. Alessandro is a thought leader in the use of advanced technologies in supply chain and in the healthcare industry, has been has looked at this in a very thoughtful manner for both his company, but also for the field more generally. And is someone who we ask questions as to how to think about new forecasting models oftentimes. The second panelist is Ramatu, who's the CEO of or Executive Secretary of the Kaduna State Health Supplies Management Agency. And Ramatu and the agency she runs, once again, have been at the forefront of making improvements in their supply chain, trying to bring new technology in forecasting and inventory management and delivery distribution. So we'd love to hear perspectives from Ramatu. And then we have Glenn Milano, who's the technical lead for forecasting and modeling work at USAID in the Bureau of Global Health. So we'd love to hear from him. What was this surprising to him as he was evaluating the results? And so let me start with Alessandro. Alessandro, first of all, welcome to the Center for Global Development. We want to ask, is this something that surprises you, that a global competition for forecasting clinic level demand, does the winning outcome surprise you? One. Second, we also want to understand, when you at the Merck Group think about sourcing the best algorithms, sourcing the best technology to solve your forecasting and your inventory management and other problems, do you go to traditional vendors? Do you develop new vendors yourself? And by vendors, I mean partners who help solution for you. And how do you balance the two? So, Alessandro.
Thank you, Prashant. So thank you for inviting me here. And by the way, I mean, it's a fantastic idea, fantastic competition. I mean, this is exactly the right thing to do to improve access to health. So I truly believe that is exactly, I mean, there are two elements, as we know. One is improving the forecasting, so the demand signal, and the other improve the supply. And they go hands in hands. And I think we, I mean, as pharma producer Merck, I mean, like the other producers, should work on the supply part. Whereas obviously, wherever is the demand signal most near to the country, obviously improving forecasting in the country is the right thing to do. So combining the two improvement, hopefully we improve the access to health. So fantastic activity, really. And I was pleased to join this panel. So, I mean, to answer your question, I think, no, I wasn't surprised. I was pleased to see that, again, small startups, I mean, small, big, whatever it is, but fantastic small developments, opportunities are coming up as winners rather than big multinational and so on and so forth, because I truly believe that in the area of technological advancement, it's really a sort of crowd knowledge share that will make the next level. And that's specific for technology. Whereas in terms of improving supply, is collaboration across different elements of the supply chain that will improve it. So not at all a surprise. And then to answer your second question, how do we deal in Merck KGA about the forecasting and which type of technology we use it? I would say that we also invest a lot in small startups in a sort of tailor-made solution that develop the best algorithm or the best machine learning based solution for us. We have seen it, without mentioning names, that traditional or bigger companies and whatever, they still have good solution, but probably they're not fit for use for the complexity of supply chain that has to serve 65 different countries, and they have fundamentally 65 different go-to model. So having tailor-made vendor and tailor-made solutions that are scalable is great. And the other element is that works if we would develop a strong data scientist, like we did community within the organization. So that could work indeed to work with these startups, having a strong data sciences that we have in Merck. And the combination of the two really helped us a lot.
Thank you, Alessandro. I have more questions. I'll come back to you, but let me first go to Ramatu. Ramatu, once again, what do you take away from the prize outcomes? And also, how do you think about new technologies and data science at the agency you run, not just for forecasting, but for many other parts of supply chain? Do you think about them as new technologies that will come to you from your traditional development partners? Or do you say, well, let me think about who are my non-traditional development partners and let me actively scout for them? How do you manage this?
Yeah, thank you, Prashant. And I'm so excited to be here today. And the competition is really, really great. I'm happy to be part of this. And for me, it just resonates with what I do every day. So I love the part that we have small startup companies They have so much to offer. I have experience also working with startup companies, and we have been growing together. And like you talked about in Kaduna, we've had to go back and do it ourselves from the scratch. We've had to develop some of our systems together with our provider because that's very important. It's very difficult to find a solution out there on the shelf that you just pick and run with, knowing the sort of challenges that we have in terms of infrastructural issues. So for example, you couldn't just expect to deploy a solution that works fully online in Nigeria because the larger population of people are in remote areas, so they can't use that software. So for us, we use short message system that we developed locally, works both offline and online. So we've had to tailor it to our own needs, specific needs. And I think that's the way to go for public health supply chains. It's not a one size fits all, and that's very difficult. We see that in solutions that have already been developed for another market or for another sector entirely. So in Kaduna State, we do it ourselves, and I'm just so excited that there are so many startups out there also towing that part.
Thank you, Ramatu. I have one other question I'll come back to. Let me first go to Glenn Milano, who's the technical lead for forecasting at USAID. Glenn, just tell us a little bit more about the participants in the competition. What kinds of groups did you see come? How you selected? So I think many people are curious to know what led to the prize, what criteria and metrics were used for the prize. And also, how does USAID see the winners or the algorithms and the methods which the winners have used becoming more mainstreamed, not only in Cote d'Ivoire, but also in other USAID countries or USAID supported countries, but also in new programming and new work that USAID will do in this area. So Glenn, over to you.
Thank you, Prashant, and thanks for CGD for hosting this event. This has been a tremendous learning experience for us so far, and we look forward to continuing that learning and sharing that learning a little bit more widely. And this event in particular is one of the things that is relatively new for us in terms of sharing some of our work. And so that's one way in which we're going to be sort of increasing our sharing of this information. We also learned that putting on a competition is really an excellent way to build a body of ideas and approaches on how to solve complex problems. Also engage partners outside our traditional development contractors and bring new ideas and approaches to the table. We also learned that hosting a competition is very time intensive and complex. Everything from the design, data collection, selection of performance evaluation metrics, and setting up the application process required significant effort and resources. That said, we've also learned that we're going to be able to put what we've been able to receive from all of the competitors to good use, both in the co-creation process. That is the next step in this project that we've developed, as well as writing some papers for the International Journal of Forecasting and other venues where we can share some of these learnings. Some of the key things that we did learn was the actual collection of the data. The Inventec team mentioned this earlier in terms of the ingredients in the salad. It was really an extensive effort to collect this data, and my hat's off to my colleagues in Cote d'Ivoire and the many folks that helped us assemble what I believe is sort of the largest collection of data for this particular element of the health supply chain. And thinking about transitioning to the next phase of the project, where we're going to be essentially trying to build a real-time system, we certainly have some work cut out for us to make sure that the available data is available for sort of real-time intelligent forecasting solutions. The models submitted also taught us a few key things, such as all of the models, as we've heard, have been machine learning based. The most accurate models use the light GBM algorithm, which was also successful in the recent M5 forecasting competitions, which are the most well-known and influential of all forecasting competitions. We received submissions using both R and Python programming languages. Python was the dominant one, but the winning models were in both of those languages. And lastly, I think one of the biggest things that we've learned, and we've been talking about it a bit so far, is that bringing people together from many different backgrounds and sectors really does help create unique and powerful solutions.
Thanks, Glenn. And to everyone who's joining us at this event through YouTube, please, or other channels, please send us your questions. If you're on Twitter, it's #CGD Talks, email events@cgdev.org, or through whatever channel you're joining, there should be a way to send in your questions. We'll address them to the panelists or the winners. But before going on to back to Alessandro, Glenn, I wanted to ask, I mean, what we learned from this is not just for USAID. I mean, this is something we want to see other global agencies who are involved in healthcare supply chains in international development, but also country governments, to be able to internalize better. So in that sense, the competition is not only about seeing who's achieved the best on the metric, but the learnings of the models, etc. So is there a plan to get others, the Global Fund, Gavi, other agencies also to take this more actively, and of course, country governments, and how will you diffuse that?
Yeah, Prashant, thank you. We've talked about this in the past. We recognize the importance of sharing this information and the learnings from this competition and the follow-on grant activity. And so, this event is one great way to begin to bring together this sort of expanded community that's become part of this. So folks from Global Fund, Gavi, and other international public organizations, if you want to reach out to me directly or to Prashant to begin some of that discussion, we would love to put together some webinars with the winners to talk more specifically about the technical details of their models, maybe look at individual country contexts in addition to Cote d'Ivoire, and begin to really engage in a more proactive socialization of the learnings. I had mentioned earlier that we're also going to be likely writing a paper for the International Journal of Forecasting, where we're going to look specifically at the varying approaches, the performances of the different models, and that, of course, will be shared widely. We're going to be doing some presentations at the Conference for Forecasting for Social Good, which is going to be held in Bordeaux, France, hopefully in July 2021. I think we are a development agency that implements through grants and contracts and cooperative agreements. And I think one of the key things that we've learned is that this methodology and this approach, much like what Inventec is doing to incorporate AI and machine learning into their core business processes, we will be looking to do the same. So future contracts, future grants and cooperative agreements will most likely see requirements for incorporating AI-related solutions.
Okay, very exciting, Glenn. Alessandro, so one of the things that we heard from both Inventec and from Rashid was using new techniques on historical consumption data. And I think we also recognize that the real next step in improving forecast accuracy will come by bringing together new and more innovative data sets, things that we don't typically think about as contributing to a demand forecast. So what are your experiences about demand forecasting using what is routinely and systematically captured in your enterprise systems versus encouraging people to go outside and look for novel data sets and see what more information value can they bring to improve forecasts?
Prashant, this is an excellent question. This is really an excellent question, and is exactly how we can improve forecasting. So let me try to explain it. I mean, I think what has been said by Vintech, what has been said by Glenn, what has been said from you is exactly right. Improving forecasting can be done by having better models, more developed algorithms. But believe it or not, those algorithms are more or less the same. So the improvement is incremental. Whereas adding more data into the model itself, that's what really makes a difference. That's what we have seen, it really makes a difference. So eventually, it's better a broader set of data, more comprehensive, with a less sophisticated model than an advanced model with a limited set of data. So the focus is exactly that, it's focused on data. And I remember one of the elements, Glenn Milano said it before, that one of the critical winning factors for the winner was the collection of data. This is exactly the right thing to do. So in this context, what we have done is indeed we try to expand in the source of data as much as possible beyond the traditional ERP system or planning system. So gather information about demand given by weather condition, given by shortage, announced by the FDA. So to your point, integrating more and more data sets and data points into our model to improve forecasting. And we have seen this can bring up between 5 to 10 points according to the level of forecasting. Obviously, if you are in the 90% forecast accuracy, we know that the improvement rate is smaller, whereas if you're in the lower rate, the improvement rate is higher. But definitely, if I have a recommendation to do, is exactly this. Increase the data source, connect all the data. The more data set you have it, the better the result will be.
Thank you, Alessandro. And the CGD forecasting working group in 2006 had this idea of what we call as an infomeasury, which is a place to bring together as many different data streams together and then put that out in a sharing mechanism, not necessarily all public, but with some kind of selective sharing methods, so that both forecasting, but also supply planning more broadly can be done with a wider set of data. So let me go to Ramatu. Ramatu, at Kaduna, are you looking at things beyond just what was the last 3 months consumption? And if yes, what other factors are you starting to include in your forecasting?
Yeah, thank you very much, Prashant, for that question. So we started in Kaduna to look at demand data because that's the first point of call. And we try to identify the true point of getting our demand. But right now, I can tell you that we've moved way beyond that. And Kaduna has been transforming our supply chain for more than 4 years now. We've moved on to inventory management. We've integrated our systems. Our warehouse management software is integrated into our business analytic platform. Also, our SMS platform is also integrated. So we've moved beyond that. We've been able to develop strategies to align with our system now. For once, we're looking at pooled procurement, which was impossible before with the sort of data that we're getting. We're also looking at centralized distribution of money. Right now, when we started the transformation, we're at 6% availability of medicines, but we've been able to get beyond 70% availability of medicine. And that has really increased the trust in government system. We have facilities requesting to join our program, and we have continued to bring in different forms of data and trying to also work with people because it's really important. We can talk about algorithms, we can talk about machine learning, but we have to co-design and co-create this with the people. The frontline workers are very important and they need to understand what is at stake and how it's going to reduce the burden of paperwork on the healthcare system, increase precision, accuracy, and speed, and also take off the burden of repetitive and laborious tasks like demand forecasting. We've relieved health facilities of those difficult tasks. We've taken them to the centralized level. We've integrated all our data, and we're adding more data. So we have huge data in our databases now, and that is helping us to make better decisions with our data. We do data-driven deliveries, procurement, all decisions in our supply chain are currently driven by data.
Thanks, Matthew. We have a series of questions coming from participants who joined us at this event. I will pose one question to both the team from Inventec and also to Rashid. So as you think about furthering your work in this area, I mean, one, recognizing that, contraceptive forecasting depends upon, being able to forecast user preferences for different methods. So in that sense, choice behavior is intrinsically a core component of how you develop a forecast for family planning and contraceptives. Second, I mean, in doing so, and as you expand your work, who are the kind of people, experts outside your domain who you would say, wish I had a clinical psychologist to work with me, or I had someone who focuses at the National Meteorological Center to work with me? Who are the people that you would say, wish we could work with an expert in this area, and that'll help us improve our forecast? So let me start with you, Trista, with your thoughts and where would you like to seek experts outside of the domain, and then I'll go to Rashid for the same question.
Yeah, great question. This is exactly what we face when we start to integrate our AI solution into our factories. So we are not factory domain expert or the frontline worker of healthcare. So at first, we are really humble. We just be the shadow of our worker. So we just like stand by the side and just watch how they operate and just learn from them. And then I think human, is really the ingredient of all solutions. So we learn from their experience, and sometimes it's right, sometimes it's wrong, but most of the time we get like great insights from their solutions, and then we just apply that to our algorithm or our data preparation and all that. I think similar to our experience. So I'm guessing for this contraceptive usage problem, more data is definitely the way to go. And honestly, we are not in this domain. We are totally new to this health product distribution problem. So I would like to first, like what we did before, right? Learn from the expert, and then go to the clinic, and then go to as many clinics as possible, and go to different countries if possible. And I'm sure there are differences, devils in the detail, the differences in different size, different countries that can educate how our selection of model and additional supplementary data and all that. Thank you.
Thanks, Trista. Rashid, you compete in this as an independent forecaster, which is outside of your day job. So if you were to make an ask, in doing this as an independent forecaster, I wish I had this one person or this one type of expert, who would you want to have on your team? Another algorithmic person or someone from a very different domain?
Yeah, okay. Thank you very much for your questions. Actually, I'm not an expert in health industry, so I don't know who the people that I would like to invite. But in overall, I don't have the domain expert in health, for example. What I can do is actually to explore the data. So I need to understand the data first. Maybe there is a pattern from the data that I can input to the model. So based on my experience, in different industry, there might be different pattern. In business, there might be in the end of the month there might be a spike on the data. So things like this that need to be added into the model. So in health industry, I think that if as a newbie in health industry, I will explore the data as much as possible first. And yeah, if there are someone I know that know about the health industry, I will ask to them. Yeah.
Okay. Thank you, Rashid. We're almost out of time, but Glenn, I hope this gives you some ideas about both the winners are seeking more connection with domain experts in the field. So hopefully, as you progress this work, you can take this. I want to end by saying one quick thing, which is there is a real opportunity to change the way we manage supply chains for health products, especially in areas which have choice behavior, very important consideration. And it is about finding the right way to channel all the new algorithms, the new technologies that have become available today. The competition is one way, but I think it's important for us to keep looking outside of our usual domain. Secondly, it's also important for us to keep updating our prior assumptions about who to go to when we have a supply chain problem. Let's not become biased by our prior assumptions that this is the group to go to if we have to solve a supply chain problem because they are the ones who've done it historically, or they are the ones that I see doing it for other categories. Look beyond, use explicit and objective performance metrics. And yeah, that would help us advance the field. So I want to thank everybody, but I'm seeing that Nancy wants to make a quick comment. Nancy.
Sorry, yes, thank you very much. I just want to sort of thank everybody, but also, again, the focus on reproductive health for USAID is really fundamental to improving health outcomes and saving lives. And this work that everybody's doing will advance us. I also want to just take a moment to also thank my colleague, Please Camden, and Kevin Piltz, who really shepherded this program for Cote d'Ivoire and got us here. And to all the expertise, both all of you who are participating today and many others who will be contributing in the future. And we look forward to working with Inventec. We welcome you to country, and we can't wait to work with you directly. So thank you very much for this opportunity.
Thanks, Nancy. With that, we are going to call this event a close. Thank you, everyone. Keep up the good work in using data science, technology, algorithms to develop better forecasts. Patients need it, and clients need it. Sexual and reproductive health needs it. All other areas of healthcare need it. So keep channeling good algorithmic work in improving forecasts, no matter which organization. And if you participated and are not a winner, we still think this was a great attempt at bringing all this energy together. Thank you very much, and look forward to seeing you at a future event at CGD.
you.